that you, Russ?
Did you hang up or mute or something?
I don't hear him. I don't see him. I haven't identified him. Should I identify him?
Shouldn't make a difference. Oh, it shows he's muted now.
I see that. Hold on.
Hi, guys. It's Russ.
There we go.
Russ, hey.
I'm here.
Fantastic.
Hi, Russ. This is Casey. How's it going?
Hi, Casey. How you doing today?
Yep, doing great.
Yeah, just double check the audio.
I just want to get some tests on it.
Looks like we're just waiting on Bill, and we should be going as planned so far.
Gotcha. Hey, Casey, in case I forget, I would like to talk to you offline about kind of the work that we've done with NIOSH and OSHA right now in this area.
Great, Russ.
And so we got to figure out how to get a hold of each other.
Yeah,
Other than
that's great. I can, well, certainly Bill can connect us, so we could ask him to do a bridging email, but I can also just give you my email address now if it's useful.
yeah, go ahead. What's your email address?
Yeah, it's only 4 digits, so it's AHX6, Apple Henry X-ray 6,
Okay.
at cdc.gov.
Gotcha. Yeah, we just did a big symposium in Atlanta.
Oh,
People
super.
on the subject at Emory University, and wanted to get the folks from CDC out there, but they couldn't attend. They did send us a lot of stats and PowerPoint stuff, so I just thought I'd grab you offline after this is all done and kind of fill you in what we do and how we kind of work with other government agencies across the country on this subject.
Yeah, that would be super.
All right, well, I'll pop you an email later on today.
Okay. And Russ, I think I pass over to you after I do the intro. How do I pronounce your last name?
Boy, I'm glad you asked. It's Kenzior.
Okay. So 3 syllables, Kenzior.
That's correct. The D is silent.
Okay. Kenzior. Got it.
You're just going to grab Bill, and then in at 10:50, that's when we're going to put. You'll hear the hold music, and then we'll come back at approximately 11 o'clock. We might hold off a little bit depending on if the room's a little light, but the last we checked attendance, it was coming up close to 500 attendees for this event, so I anticipate a good crowd today.
That's super. Thanks.
Yeah, I know you mentioned like adding an email going out to some of your people about this, and I think it definitely had a great impact.
Oh, that's great. That's wonderful to hear.
Did you get the white covers from Vega? where might they have been?
Radio crew.
Did they tell all of them? Did PRG have any? No.
We never brought
We
them down
never
to
brought
PRG.
them
They were never in any of the interviews.
So,
Hopefully Lake Coast held on to them.
yeah, maybe just shoot a message to Chad at some point and see if he picked him up.
I was thinking about that. Everyone. Yeah, Bill was just finishing up a call, and he should be here momentarily, guys.
Okay, sounds great.
I came over, you were on a call.
I just unmuted. You want to say hi to Russ and Casey?
Good morning. Hi, Russ. Hi, Casey.
Hi,
How
Bill.
are you folks?
Hi, Bill.
Hi, Bill. How's it going?
Going well. Did you let them know what the current registration?
Oh, no, I forgot.
Oh,
I did. I
Oh,
talked to
you
him.
told
I
him?
told him that we're very close to 500.
oh, really?
Yeah.
Nice, wonderful. Thanks for all your extra help, Casey. I saw that article that you included in your most recent newsletter yesterday. I think
Great.
it's very
I'm
helpful.
happy that it hopefully did some, did a sort of push to increase the numbers. That's great.
Yeah, and I noticed a lot of them were coming from not our customer base, but so I'm presuming it was from your people reacting to your newsletter yesterday. So that's great. Appreciate
Yeah, we
that.
also we kind of blasted the invitation to our members, I guess a week or so ago as well, Bill. So you may have seen
Did you,
a couple of. Yeah, we have a captive about 1,500 members, so we sent it out to all of our members.
Nice. I'm glad you did that. Well, that
Yeah.
accounts for the great attendance that we're having. And we'll archive today's session, so if you want to go out again later to let people know they can continue to access it, we'll provide you with that info.
Great.
If
Yeah,
just
we do actually send that out to anybody that's registered, so they'll have the link. But
okay,
there's obviously going to be links that you can send out to other people as well.
sure. So even people that have not registered for the event will be able to access it at a later date. Oh, and just
great.
so you folks know, we typically make available the PowerPoint slides to the attendees. Are you folks okay with that?
Yeah.
Yeah, it's fine with me. This is Casey.
Oh, okay. Russ?
Yeah, not a problem.
Okay. I thought as much. Thank you. We'll let people know at the introductory comments about that. I am just going to break away and grab a cup of coffee, and I think, when are you going to go to silence?
3 minutes.
3 minutes?
You can start joining. So.
Everything seems to be working technically
Yep.
and all that.
I think so.
Do you folks have any questions?
Nope. Good to go.
Casey or no?
Okay.
Okay.
Yeah, feels great.
Do we want to just start at like a little bit later, or we want to start promptly at 11? What's the call?
We'll see
We'll
how
see
the
how
numbers
many,
are.
yeah, what the attendance is.
No later than 2 after.
Yeah,
Okay.
I don't think you wait more than a couple minutes at a late. And you still have a few introductory comments, so even people coming in during that aren't
Yeah,
missing the
about that.
presentation, so,
Okay.
yeah.
All right, I'm going to go grab a cup of coffee.
Fantastic. So in about 2 minutes, I'm going to start the whole music, guys. If you need anything, just reach out on the chat.
Okay, sounds good.
Recording.
Oh, yeah, actually,
We just started the recording, didn't we? Or did
no,
we?
on the door.
Oh.
No, we already said on the door.
Yeah.
I don't know what happened. I never lock my drawer. Because I don't read it.
The professional sign out. So you're using a Sharpie.
Not very thick Sharpie though, but
I have a
whatever.
recording.
So you can special do and okay. Advance we do.
Right.
Okay.
All right, I'm going to put the hold music on, guys, because people can start jumping in the room. See you guys in a bit. Yeah,
Okay.
make sure you guys mute them yourselves.
Standard in the industry, empowering your employees with certification on processes including cleaning floors, restrooms, healthcare facilities, and more. For information about the CITS program, go to issa.com/CITS. Thank you for continuing to hold. An ISSA representative will be with you shortly. The new ISSA Clean Standard for measuring the effectiveness of cleaning in institutional and commercial facilities provides facilities with a tool that will help them measure and monitor the effectiveness of their cleaning processes. To find out how your company can use the Clean Standard to ensure that your cleaning programs are delivering a healthy, safe, and productive indoor environment for building occupants, go to issa.com/clean standard. Please continue to hold. We will be with you in a moment. Are you getting the most out of ISSA.com? You can use the Buyer's Guide to search for companies or products, view industry-specific educational videos on ISSA TV, and stay abreast of breaking industry news. You'll also find all you need to know, from upcoming industry events to informative articles and educational products to member-only. So much more. Take advantage of a valuable resource you may have been overlooking. Visit ISSA.com today. Thank you for holding. An ISSA representative will be right back to assist you. Don't miss the cleaning industry's biggest European trade show, ISSA Interclean Amsterdam, May 10th through the 13th, 2016. The Amsterdam show offers an excellent opportunity for industry professionals to learn of important developments, make new contacts, and exchange ideas in a stimulating multinational environment. For details, go to issa.com/Amsterdam. Please hold. An ISSA representative will be right back to assist you. Have you heard about how ISSA is helping its members change the way the world views cleaning? Check out the expanding set of Value of Clean tools you can use to provide your value to customers at ISSA.com. Thank you for holding. We will be with you in a moment. Did you know that ISSA's Cleaning Industry Training Standard, CITS, can help managers improve professionalism and instill pride in frontline cleaning professionals through training? With CITS, you can verify your training program to the gold standard in the industry, empowering your employees with certification on processes including cleaning floors, restrooms, healthcare facilities, and more. For information about the CITS program, go to issa.com/CITS. Thank you for continuing to hold. An ISSA representative will be with you shortly. The new ISSA Clean Standard for measuring the effectiveness of cleaning in institutional and commercial facilities provides facilities with a tool that will help them measure and monitor the effectiveness of their cleaning processes. To find out how your company can use the Clean Standard to ensure that your cleaning programs are delivering a healthy, safe, and productive indoor environment for building occupants, go to issa.com/clean standard. Please continue to hold. We will be with you in a moment. Are Are you getting the most out of ISSA.com? You can use the Buyer's Guide to search for companies or products, view industry-specific educational videos on ISSA TV, and stay abreast of breaking industry news. You'll also find all you need to know, from upcoming industry events to informative articles and educational products to member-only sales tools, plus so much more. Take advantage of a valuable resource you may have been overlooking. Visit ISSA.com today. Thank you for holding. An ISSA representative will be right back to assist you. Don't miss the cleaning industry's biggest European trade show, ISSA Interclean Amsterdam, May 10th through the 13th, 2016. The Amsterdam show offers an excellent opportunity for industry professionals to learn of important developments, make new contacts, and exchange ideas in a stimulating multinational environment. For details, go to ISSA-Amsterdam. Please hold. An ISSA representative will be right back to assist you. Have you heard about how ISSA is helping its members change the way the world views cleaning? Check out the expanding set of Value of Clean tools you can use to provide your value to customers at ISSA.com/value. Thank you for holding. We will be with you in a moment. Did you know that ISSA's Cleaning Industry Training Standard, CITS, can help managers improve professionalism and instill pride in frontline cleaning professionals through training? With CITS, you can verify your training program to the gold standard in the industry, empowering your employees with certification on processes including cleaning floors, restrooms, healthcare facilities, and more. For information about the CITS program, go to ISSA.com/CITS. Thank you for continuing to hold. An ISSA representative will be with you shortly. The new ISSA The effectiveness of cleaning in institutional and commercial facilities provides facilities with a tool that will help them measure and monitor the effectiveness of their cleaning processes. To find out how your company can use the Clean Standard to ensure that your cleaning programs are delivering a healthy, safe, and productive indoor environment for building occupants, go to ISSA.com/Clean Standard. Please continue to hold. We will be with you in a moment. Are you getting the most out of ISSA.com? You can use the Buyer's Guide to search for companies or products, view industry-specific educational videos on ISSA TV, and stay abreast of breaking industry news. You'll also find all you need to know, from upcoming industry events to informative articles and educational products to member-only sales tools, plus so much more. Take advantage of a valuable resource you may have been overlooking. Visit ISSA.com today. Thank you for holding. An ISSA representative will be right back to assist you. Don't miss the cleaning industry's biggest European trade show, ISSA Interclean Amsterdam, May 10th through the 13th, 2016. The Amsterdam show offers an excellent opportunity for industry professionals to learn of important developments, make new contacts.
Hello, everyone, and welcome to today's webinar on the topic of slips, trips, and fall prevention in the workplace and beyond. I'm Bill Bollock, Director of Legislative and Environmental Services for ISSA, and it's my true pleasure to serve as your moderator today. Now, today's program is brought to you by the Office of Total Worker Health at the National Institute of Occupational Safety and Health and ISSA, the Worldwide Cleaning Industry Association. Allow me to take a moment to say that ISSA is truly honored and privileged to have recently been accepted as an affiliate in the Total Worker Health Program. And I'd be remiss if I failed to mention that today's webinar is also conducted in conjunction with the National Floor Safety Institute, whose support and participation has been critical to delivering today's session. And now please allow me to introduce you to our esteemed panelists. First up, we're extremely fortunate to have with us today Dr. Casey Chosewood, who is the Director of the Office for Total Worker Health at the National Institute for Occupational Safety and Health, which, as you all know, is part of the U.S. Centers for Disease Control and Prevention. Now, in this role, Dr. Chosewood works to protect the health and well-being of workers around the nation. He also served a similar function for CDC from 2004 to 2009, when Dr. Chosewood served as the Director of the Office of Health and Safety at CDC, and safeguarded the 15,000 plus members of the workforce as they face the new challenges of the modern public health area. Next up is my good friend and colleague, Russ Kendzior, who is the President of Traction Experts and founder of the National Floor Safety Institute. Internationally recognized as a leading expert in slip and accident prevention, Russ is a nationally acclaimed lecturer, legal consultant, and author of the popular Slip and Fall Prevention Made Easy. Russ has also appeared on numerous nationally televised programs, including Inside Edition, Good Morning America, CBS News, and ABC News Primetime, What Would You Do? And last, as ISSA's Director of Legislative and Environmental.
I actually didn't know anybody to go with. I just went and ate chili.
Yeah.
Oh, is it? Where's it at? The retail? Okay.
Excuse me, could those on the line please mute your phone? We're catching some feedback. Thank you so much. I just have a couple of housekeeping items before we begin today's program. First, please note that our webinar will include a question and answer session immediately following the direct presentations by our panelists. But please feel free to submit questions at any time during today's session using our system's chat function. To submit a question, click on the private tab within the chat area in the lower left corner of your screen, and then double-click Leaders and Assistant. Okay. We'll collect the questions on this end and address as many as time permits toward the end of today's program. Second, shortly after today's session, we'll provide you with access to a PDF file of the PowerPoints that we're using during today's program. And now, without further ado, please allow me to turn the microphone over to Dr. Chosewood, the Director of the Total Worker Health Program. Casey, thank you for joining us today.
Well, thanks, Bill, and I must say to you that it's really our pleasure to have ISSA as a part of the NIOSH Total Worker Health Affiliate Program. We're honored to be part of that relationship, and we appreciate what your organization does to keep not only workers safer each and every day, but all the people who enter the spaces where work is being done by the members of your organization. So thank you very much for that dedication to healthier, safer workers as well. Well, it is my pleasure to join you guys today to talk about a very important topic, something that really matters not only to individual workers and organizations, their families, those who count on them, but really to our economy as a whole. The burden that America's workers and visitors to spaces face from slips, trips, and falls is tremendous, and we will talk about some of that information today. Our focus really is on what we can do for prevention, and we're going to use the framework of the NIOSH Total Worker Health Program to do that. So it's my first duty to describe a little bit about the Total Worker Health Program, and then move on to go into more details from all the panelists around slips, trips, and falls prevention. So I should say, as Bill mentioned, that we are part of the National Institute for Occupational Safety and Health. It is part of the federal government. So I suppose maybe I'll start off by saying I'm from the government and I'm here to help you today. And you know, oftentimes it may be true in Vegas that what happens in Vegas stays in Vegas. Well, that's actually not true when it comes to the whole issue of work. What happens at work doesn't stay at work. And what happens in our private lives, what happens at home, doesn't stay at home. In fact, there's this sort of constant interplay between home and work, especially as it relates to our health and well-being. And that is why we took the tact at NIOSH of introducing a program that comprehensively looks at this intersection of home and work with the sort of outcome desired of improving the overall well-being of workers and the well-being of organizations. If you look at the interface between home and work, between the amount of time we spend away from the job and the time we spend on the job, there's a tremendous amount of challenges that lie along that intersection. We are more prone to troubles and difficulties at work when we're having difficulties at home, and vice versa. When work is stressful and there are more challenges at work, we carry home in our virtual lunchbox, if you will, those challenges. So each and every day we shuttle risks, exposures, and concerns between work and home. Because of this truth, when we take a comprehensive look at protecting workers, when we look to optimize the way we safeguard the people who leave and come to the job each day, it's very important for us to look at challenges and risks on both sides of that interface. And that's really what the Total Worker Health Program is all about. In a nutshell, here's the definition. Total worker health is really an organizational responsibility. It's when employers put in place policies, programs, and practices that really do two things, that protect people from work-related safety and health hazards. In other words, create a safe place for people to work. And then not stopping there, adding to that safe environment efforts to promote injury and illness prevention, both illnesses that occur related to work and those that occur away from work, with the goal being to advance the overall well-being of workers. Put simply, the goal is first to keep workers safe. Don't stop there. Invest more in workplace health with the outcome of creating worker well-being. I like to sort of illustrate by giving you three examples of a bad company, one that's not so good, an average company, and then a great company. So a bad company, a poor company that really doesn't get the essence of what total worker health is about, really approaches an issue. They bring their workers to work in the morning with a certain level of health. They fail to protect those workers throughout the course of the day, and they send them home at the end of the day with less health than when they arrived that morning. We don't consider that a very good company if they're not protecting people from hazards on the job. The average company, a good company, will bring their workers to work, and they will keep workers safe from injury and illness related to work, and they will send their workers home with the same level of health that they arrived that morning. Well, that's pretty good. But the best companies are those that bring their workers to work in the morning with a certain level of health. They protect that health throughout the day by safe working conditions, and then they add to the health and well-being of their workers through these programs, practices, and policies that really allow greater health to evolve, that allow greater health to develop, so that at the end of the day, they send those workers home with more health than when they arrived that morning. So imagine these great companies that really do succeed in the workplace, that people clamor to work for that continuously improve the health of their workforce each and every day. That's a really desirable endpoint and goal. And that's great for workers. They carry that increased health home with them in many ways to increase the health of their families, their communities. It helps them with their own personal economy. They live longer, fuller, healthier lives. But here's the great news. Those workers who went home at the end of the day with more health, they come back to work the next day with that additional level of health. And that expresses itself in the form of increased productivity, less likelihood for injury and illness, more prone to deliver good customer service, more energy and more engagement in the work itself, more fulfillment in the job. And that virtuous cycle of improved health of workers, improved health of communities and families, and improved health of organizations and businesses and our economy is really the desired endpoint for total worker health. I remind folks that the cornerstone of any total worker health program is making sure that we make working conditions as ideal as can be. For instance, this guy is probably a lot more interested in a cleaner, safer work environment than he would be in, let's say, the workplace wellness program that you offer at the end of the day. So first dollar investment, the cornerstone of total worker health, is improving the conditions of work so people have safe, healthy jobs. Total worker health is not your traditional employee wellness program. It's not something that you can drop in from the sky. Total worker health really needs to be done in a place where the way work is organized contributes to worker health and not worker injury and illness. We don't think that workplace wellness programs that have no unproven or that have no value or their evidence base is lacking should be part of a total worker health program. And we think that wellness programs that don't ask employees about work factors and don't allow workers to participate and contribute to the development of their health programs, those would not be consistent with total worker health either. Here are some ideas about what total worker health policies and programs actually look like. Keeping workers at the center of your operations, letting them participate in the development of programs, policies that actually work for them, letting them help solve problems that come up through the course of the day, concentrating on those built-in things like paid leave, health care benefits, sick leave. We know those have a positive impact on the health and well-being of workers. Paying attention to equitable wages. Beyond not having a job at all, wage is one of the greatest predictors of the health of a workforce. Higher wages translates into better health outcomes, and we believe contributes to this positive cycle of better economic growth for the nation. We also think that paying attention to shifts and staffing levels, keeping overtime work voluntary and not forced is an important component of protecting workers, certainly avoiding violence and discrimination in the workplace, training our supervisors on what it takes to best manage a population so that health is the desired outcome, safety is the desired outcome. These are skills that can be taught at first level management and supervision. Avoiding work intensification. So downsizing oftentimes has the side effect of doing more with less resources, and that's a real constant challenge in many, many organizations today. There is a health price to pay from that type of work intensification. Allowing folks to integrate work, family, and life responsibilities, paying attention to how work may have an impact on chronic health conditions that are far, far more common today than ever before in our workplaces, partly because of the aging of our workforce. And that brings us to our last issue, providing workplaces that do support productive aging across the entire working span. And when I come back to talk to you a little bit later in the webinar, I'll go into more details around the challenges of keeping people safe from slips, trips, and falls as our population ages. But now it's my pleasure to join one of the panelists on today's webinar to continue to tell this story. I'll be back in a few minutes to talk about total worker health in the context of slips, trips, and falls. But first, let me pass the microphone over to Russ Kinzior. He's going to lead off the next portion of our webinar. Russ?
Thank you, Casey. Appreciate the kind introduction. And by the way, I do want to echo much of the comments that you made. Preventing falls is something that takes place more than just in the workplace and home combined. The excuse me. The cost of these injuries is oftentimes generated by the workplace, and many of these folks that encompass a slip and fall event will bring it home. So it becomes very, very costly, very timely. Excuse me. Excuse me, guys. Got to catch my breath there. Just had a cup of coffee. The topic that I'm going to be speaking to today is called preventing slips, trips, and falls. And the real issue comes down to, well, just a number of things. Things that the NFSI had adopted many years ago related to the subject. Excuse me, guys. Got to catch my breath. For those of you who are unfamiliar with the NFSI, we were founded in 1997 as a 501c3 non-for-profit organization. In fact, the ISSA was one of the founding members of the NFSI. So we have a great deal of gratitude to Bill Ballack and the folks at ISSA. The mission of the NFSI is pretty simple. It's to aid in the prevention of slips, trips, and falls through education, research, and standards development. For those of you who are unaware of the NFSI's role in this area, we are actually the ANSI standards developer and serve as the secretariat of the NCB 101 Committee on Slip, Trip, and Fall Prevention. If you look at the next slide, you'll see that this is a multi-industry problem. How and why people slip, trip, and fall is not really all that simple. It's not contained to a particular industry, but it's actually quite broad. If you look at the property owner and the role that the property owner plays, ultimately they're the responsible party. So those who own businesses and employ individuals, well, as Casey alluded to, they're kind of the ones that are on the hook. They're the ones that want to return their employees back home in a better or at least same condition as they arrived. But if you look at really what occurs when a slip and fall takes place, it oftentimes becomes the blame game. That's where a slip and fall would take place. Oftentimes there's a hazard on the floor. The floor care provider, the janitorial company, whoever it might be, the floor care products, finishes, etc., get blamed. In other words, the property owner will blame somebody predominantly, or I should say at first it's the floor care provider. They oftentimes look to the insurance industry. It's so common to hear, sadly, when talking to business owners about the subject that, you know, when asked how big of a slip and fall problem do you have, or do you have a slip and fall problem, many of them will reply back by saying, yeah, we sure do, and, well, that's why we have insurance. That's not a good answer. In fact, it's one of the most common answers, but it brings more stress on the overall condition if we're looking at prevention. The legal industry obviously plays a big role, and everybody's afraid of lawyers and lawsuits. And one of the biggest drivers for the legal industry is the medical industry. The cost of medical coverage, the cost of medical care can be very, very expensive. And for those individuals who simply don't have adequate care, looking at the cost, it oftentimes requires litigation or filing a lawsuit just for the injured party to recover health care costs. Now, that's not always the case as it relates to workers' compensation issues, but it does demonstrate another growing trend, and that's the fact that people are living and working longer in the United States. The average victim of a slip and fall is a woman over the age of 60, and it's not uncommon today to see people working in their 70s. In fact, if you go to a Walmart store, you'll see the first person you see is the greeter, and that's usually a senior citizen. The average cost of slip and fall claims, and this is just a claim, this isn't a lawsuit, just simply processing a claim, is just over $5,000. And litigation costs can clearly reach well over $100,000. If you look at the graph, if you look at the trend that's taking place, you'll find that our country is getting older, and that's not any surprise. In fact, the baby boomers are retiring at a rate of 10,000 per day. So if you do the math and you look at the cost of the problem today, you're only going to find that it's going to get worse over time because we're growing older, and older folks tend to slip and fall more commonly, and the cost of injuries for them is significantly higher. When we look at the industries that are most affected by slips, trips, and falls, it's pretty much the top 10 industries: healthcare, food service, hospitality, office, and even the gaming and casino industries are seeing an increase in these types of injuries, and it's not because of fraud. In fact, we're going to talk about that here shortly. In fact, if you look at the graph in front of you, the causes of slips, trips, and falls, fraud represents only 3%, and that's an estimate, very conservative estimate, of all claims that are filed for a slip, trip, and fall. If we look at the cost of fraud as it relates specifically to slips and falls, it's closer to 10%. But the reality is 55%, the majority of all slip and fall and trip and fall events, take place because of improperly maintained or unsafe walkways. Walkways are the leading cause of slips and falls, and many people would think it's even greater than that, but it's not. 24% of claims are the direct result of improper footwear. And again, in the workplace, that can be controlled to a certain degree. Certain industries like the food industries, the hospital industries, and others require or mandate slip-resistant footwear, and so there is a control in place for those industries, but not every other, and certainly not for home footwear. People obviously wear all types of shoes when they're outside of the job. The last two areas deal with hazard identification and training. 10% of all slips, trips, and falls take place because of improper hazard identification. That means the wet floor sign was not used properly, there was no sign at all, there was no barricading, or no verbal warnings given to an individual knowing that the hazard had existed. And of course, training represents approximately 8% of all slip, trip, and fall claims, training being improper training or no training at all. It's very common, sadly, to find many business owners, large and small, that simply don't have any training procedures, guidelines that really speak to slip and fall prevention, given that this is the leading cause of injury for most industries in the country. The first line of defense for many companies is, well, the entranceway. And many put an entranceway floor mat in the entranceway to absorb soil and moisture from incoming pedestrians' footwear. And it tends to work quite well if, of course, used properly. If misused, entranceway floor mats can present a trip hazard. Now, we like to look at floor mats as, well, as a safety product. They're no different than a hard hat or safety gloves or safety goggles. They're used to protect people. And floor mats are also designed to protect people, but if they're not used properly, they certainly can create a much bigger hazard. The most common types of hazards that we see related to the floor mats are, well, what you see here in the image. They buckle, they crack, they flip over in the wind, they migrate, meaning they move on the floor when they're walked on, they're stepped on. And then lastly, they oftentimes fail to contain water. They simply don't hold the moisture or water that's coming in on pedestrians' footwear and become kind of a big rubber stamper where people step on the mat's soaked, and then they migrate the water from the mat onto the adjacent hard surface floor, only to find themselves slipping and falling. If you look at the required levels or quantities of floor mats as it relates to soil or moisture removal, the graph that you see in front of you is actually a study done by the Windsor Corporation, and they estimated that a 6-foot entranceway mat will remove approximately 40% of moisture from people's shoes, moisture and soil, and that it actually takes up to 36 feet of matting to remove almost all soil and moisture. Now, for most property owners, they simply don't have 36 feet of entranceway to remove that amount of material from incoming pedestrians' footwear, and will therefore have to use other means to isolate or at least warn against incoming hazards. For those who are familiar with the safety pyramid, there actually is a safety pyramid for slip, trip, and fall prevention. And it looks like this. For every slip and fall fatality, for every person that dies as a result of a slip, trip, and fall, there will be 23 people that will fall and report a minor injury or complete an incident report, file a claim. And then 70 people will fall and go unreported. You'll never know about them. This is probably one area of safety that has such a large base, meaning such a large number of people that simply get hurt or become injured, and you never know about it. And there's a great deal of societal stigma related to falls. Most people, when they fall, they're embarrassed. They don't want to be seen. They get up very quickly and they kind of get out of the area because they're embarrassed that they fell. We don't find that with other areas of safety, but for slips and falls, it's very common. As I mentioned earlier, the NFSI is the secretariat of the ANSI B101 Committee on Slip, Trip, and Fall Prevention, and author a number of standards. In fact, we have 10 standards either published or in some level of publication. A brief overview of the ANSI B101 standards are listed below. You see we have a ANSI B101.0. It's the walkway auditing guideline. It's basically the rules of the road for how to conduct a walkway inspection, or what we call an audit. The term audit was used because audit means testing as well as visual inspections. A visual inspection does not include any form of testing, and many walkway hazards, slip hazards, are very complex. They're not always visible. For example, if you spill some oil on the floor, it's improperly cleaned up, and the floor is shiny, well, if the floor is shiny, it's hard to see a shiny substance on a shiny floor, and so it becomes almost invisible. However, if you begin testing, monitoring, and measuring the coefficient of friction, you'll be able to detect that hazard. The second standard that's already published, and by the way, all the standards you see in yellow are published standards. What you see in green are standards that are in the final stages of publication, and then the standards listed below in white are under development currently. But the second standard, ANSI B101.1, came out in 2009, and it's a standard that sets forth the measurement of the wet static coefficient of friction of walkways. Note the term wet. We developed standards under wet testing because the majority of slips and falls take place under wet conditions. And this standard actually sets forth a number of traction ranges whereby a property owner can identify whether or not their floors are high, moderate, or low traction. High traction floors have been clinically proven to reduce up to 90% of slip and fall occurrences, and that's the gold standard. That's the range of friction that you want your floors to be in. If the level of friction of your floors, when measured per the ANSI B101.1 standard, is lower, it doesn't necessarily mean they're unsafe, but yet the risk of a slip and fall does in fact go up. So low traction floors represent the highest risk, high traction floors represent the lowest risk, and the goal is to, first of all, identify the floor's slip resistance and then understand what the risk is. The next standard you see in yellow is, the next standard in green is the B101.2 standard. It's under development. It's a means by which manufacturers of cleaning products and treatments, primarily those in the janitorial industry, can now test their products to see whether or not their product would leave a slippery film. The standard, once it's approved, will issue 3 traction ranges, like the B101.1 standard. And floor care products will be ranked as either traction enhancing, meaning it increases the slip resistance, traction neutral, meaning it has no effect on the slip resistance of the floor, or traction reducing, meaning it actually would make your floors a bit more slippery. And again, the methodology will be defined in the standard, and we anticipate that should be published within the next 2 to 3 months. The standard below that deals with dynamic coefficient of friction, just a different form of measuring friction. Instead of static, we use dynamic. B101.4 is a wet barefoot standard currently under development for testing and measuring safety of bathtubs and swimming pool decks, or any area that people are walking under wet barefoot conditions. B101.5 is already out, and it's a product labeling standard, which I'll be showing you in a minute. B101.6 is an entranceway floor mat standard that was published in 2012, and it really lays out the rules of the road for the floor mat industry as they work with their customers on properly applying, using, inspecting, and selecting entranceway floor mats. B101.7, currently under development, is a footwear test method for shoes. It may surprise you to know that currently there is no recognized testing methodology and value connected to slip resistance of shoes. So when you buy a pair of shoes that say slip resistant on the sole, sadly that is more of an adjective than it is a descriptive naming, if you will, of the shoe itself. So we don't really know what the term slip resistant means because there's no means by which to test for slip resistance. And so many products that have that label are less slippery, but we don't really quite know what the term slip resistant as it relates to footwear means today. And so we're developing a standard that will outline that. The last two standards is the B101.8 and B101.9 standards, both in final stages of development, and they deal with floor safety management, setting forth the rules of the road for corporations, companies to put together safety policies, guidelines. And then the last standard, B101.9, is a trip and fall prevention standard. It deals specifically with the prevention of trip hazards, obstacles on floors, that sort of thing. Again, the B101.0 standard is really the key here. It sets forth the auditing guidelines, the standards by which you are to perform and inspect floors. Just recently, Assistant Secretary of Labor for OSHA, Dr. Daniels, had stated in an interview that the OSHA will now be enforcing all the appropriate ANSI standards as it relates to walkway safety under the General Duty Clause. And so what you see before you, these ANSI standards are now enforceable and will be enforced according to Dr. Daniels from OSHA. And so it's important to know what the standard of care is and what it is you can do to participate and to be part of the solution as it relates to fall prevention. This is a photograph of a brand new quarry tile floor right out of the box. This is the type of floor you'll see in a commercial restaurant, a 6x6 red type of tile. As you can see, it's very, very rough when examined under the microscope. But shortly after it's been installed and maintained, oftentimes improperly maintained, you see what happens. That mountain range gets filled up. The material you see in the foreground, that white crusty material, is what's known as polymerization. It's a combination of soap film, material that's deposited on the floor from the cleaning procedures, soap, scum, mineral deposits, and if it's a restaurant, any type of food products that have been absorbed into the floor. So clearly the coefficient of friction has been compromised. Many business owners, or in this case restaurants, simply don't recognize that the floors become more slippery by looking at it, and therefore the necessity of testing and examining or auditing becomes that much more important. There's a wide range of testing devices and instruments. Here's just an example of some. There's robotic type devices that you see in the top left that are self-propelled. There's manually operated devices that come in many different shapes and sizes. The National Floor Safety Institute actually has a means by which to recognize devices. We actually have an approval process, and for more information you can visit our website. But there are some devices that simply work better, more effective, more reliable than others, and we actually have a very rigorous procedure that manufacturers of such devices can submit their tribometers to get approval. And so when you're taking measurements of your floors in your environment with any of these tribometers, you want to make sure you're getting good and reliable data. And so we have a process for doing that. Just for informational purposes, there's about 70 different ways to test friction. That's right, 70. This is just an example of some of the more popular types of devices, and many of you may actually use them. Here's the label I promised I would show you. This is a product label that will hopefully soon be used by manufacturers of floor coverings and cleaners and treatments, coatings and paints nationwide. It's ANSI B101.5, came out a few years ago, and it's designed for the consumer, whether the consumer be a homeowner or the consumer be a business owner, that when they're selecting products like floor coverings, floor cleaning products eventually that will be rolled into this label, floor treatments, coatings, etc. You'll see this product label, and basically what it represents is a gas gauge, low traction to the left, high traction to the right, and it represents the coefficient of friction, in this case static coefficient of friction, multiplied by 10, so it's a whole number, where when you measure coefficient of friction, it's a fractional value. Most people don't understand fractions, and so we wanted to make it easy for everyone to understand what the coefficient of friction or slip resistance of products will be. So you'll be seeing, hopefully, this label be on products throughout the country early next year. And this, again, represents kind of the drive of the NFSI in product labeling of products to protect consumers, protecting them as it relates to prevention of slips and falls. You'll also find, and many of you may have seen, the NFSI certified logo on many products. This logo basically represents a commitment, a consumer guarantee, a commitment between the manufacturer and the consumer that the product that's being marketed and sold actually does comply with and meets the appropriate ANSI standard, whether it be the B101.1 or .3 standard, or the ANSI B101.6 floor mat standard, which is actually a testing methodology for floor mats as well. But it's your guarantee that the product's been independently tested and it's in compliance with the industry's highest standard, which again is referred to as high traction. The last slide really focuses on how is all this going to affect you? What's in it, for you? How is it that you can not only help reduce slips and falls in the workplace, but also, well, save money in the process. Every claim costs money, and injuries cost a great deal of money, not to mention the human suffering and the social impact on victims. Like it or not, we do live in a litigious world, and many of you have to deal with the issue of litigation. And so if you are sued and it just happens to come up at trial that you are not in compliance with the industry standard of care, that being the standards that I've just referred to, the ANSI B101 standards, you can be held liable. And so it's really important that you establish a trail of due diligence to protect yourselves in the event that you might be sued. And so testing your floors, monitoring performance of floor mats, just having a better understanding of what's going on in your environment will really help if you are sued. If you're not, your defense becomes much weaker. Insurance underwriters also may be requiring audits in the near future, and many have been doing such for many, many years. In fact, we have a webinar on our website that was hosted at Emory University across the street from the CDC, and one of our speakers, which you can view on our website again, is Sherry Falkenberg from CNA Insurance, who did a very exhaustive study in this area, testing thousands of floors over a 5-year period, and actually correlated that only 13 to 18% of slip and fall claims, according to CNA, in their study, were on floors that were high traction. 82% of all injury claims reported in that time period in those facilities were on floors that were moderate to low traction. So it may soon be coming where manufacturers of floor care products and flooring products will be playing a bigger role in prevention of slips and falls because, well, their customer's insurance company will perhaps mandate it. Lastly is OSHA. OSHA may soon be releasing their walking and working surface requirements, which we anticipate will not only mandate the use of these ANSI standards, or at least be referenced, but also call for workers in the workplace to be protected at a much higher level. The requirement of a qualified person by an employer to perform walkway inspections, or what we call audits, will most likely take place. We anticipate that that will probably be in the proposed rule. We're not certain right now because the rule is still being proposed. But as soon as it comes out, we're going to look for some of those areas to be included in OSHA's rule. As Bill mentioned earlier, I'm the author of several books, including my most recent book, Falls Aren't Funny. if you have any questions or would like more information, please feel free to reach me. You have my name and phone number and website. Again, I would like to thank you and thank both Bill and Casey for inviting the NFSI to participate in this webinar. It's a critically important subject matter that affects each and every one of you, both personally as well as professionally. And with that, I'm going to turn this back over to Bill.
Cursor's not working. There we go. Okay. Thank you, Russ, for doing a fantastic job and for all the great work that the National Floor Safety Institute does. Again, folks, this is Bill Bollock, Director of Legislative and Environmental Services for ISSA. And over the next few minutes, I'm going to explore the powerful role that cleaning, maintenance, and general housekeeping has as it relates to preventing or reducing the incidence of slips, trips, and falls. But before I do that, I want to share with you a little bit about my background, who I represent, so that you can better appreciate our perspective on this topic. ISSA is a nonprofit trade association, and what we do is represent the commercial and institutional cleaning industry. So we focus on the away-from-home markets, and in fact, my discussion over the next few minutes will be on how cleaning and maintenance plays a critical role in reducing slips, trips, and falls away from home. Our association has grown exponentially over the last couple of years, and we now enjoy a membership of well over 7,000 members. And we represent every major segment of the industry, including manufacturers of end-use products, distributors, who are the ones that move the product in commerce, and ultimately we represent cleaning service providers, both in-house and those contracted to come in and provide cleaning and maintenance services. As I mentioned, cleaning, maintenance, and housekeeping practices play a critical role in reducing and preventing slips, trips, and falls and the consequential damages and personal injury. And really my source for that statement is found in both OSHA regulations that relate to walking and working surfaces and keeping employees safe, as well as the American National Standards Institute standards on the provision of slip resistance for walking and working surfaces. Now, as Russ mentioned, the OSHA general requirements for walking and working surfaces is soon to be revised, and OSHA had actually at the beginning of the year indicated it was going to be published back in August of 2015, but that date has come and gone, and we're now expecting publication by sometime between the first and second quarter of 2016. So in the meantime, we're left with the existing rule, and it is fairly general, but it does address three major areas. First of all, again, stressing cleaning and housekeeping and requiring that all places of employment be maintained in a clean, orderly, and sanitary condition for the benefit of the employees, with a special focus on walking surfaces or floors being required to be maintained as clean and dry. And thirdly, kept clear and in good repair, ensuring that there are no obstructions that may create a slip, trip, and fall hazard. But those OSHA requirements are fairly general, and because they're so general, ANSI stepped in, if you would, to bring more specificity where OSHA provides us with only general requirements. And most of the slides that I'll be addressing here in the next few minutes are really based on the provisions that are included in ANSI's standard on the provision of slip resistance of walking and working surfaces. A large part of that standard focuses on cleaning, maintenance, housekeeping provisions that again are designed to either reduce or prevent, if possible, of the incidence of slips, trips, and falls. Also want to point out that while OSHA is a mandatory regulation and standards are often seen as voluntary, it is important to note that where OSHA is not specific, it must follow voluntary industry consensus standards in issuing violations or citations for violating the regulations. But again, perhaps on a more positive slant, I do want to stress that these provisions within the ANSI standard, whether they be footwear, mats and runners, housekeeping, etc., the main focus on these provisions is to prevent or reduce the incidence of slip, trips, and falls. Now, these are focused again on commercial and institutional facilities, places of work, as well as places that invite the public in to take advantage of their various services. So let's take a look at what that ANSI standard has to provide us in terms of prophylactic measures. Now, the first is largely applicable in cases where we're dealing with workplaces and employers are in a position to control the type of footwear that their employees wear. Now, this is especially important in workplaces where the walking or working surfaces may become contaminated, foreseeably contaminated during the course of the workday. So employers should take into consideration whether or not safety footwear is needed, and then the type of safety footwear that is appropriate, taking into consideration things like the slip resistance of the sole, the tread design, tread hardness, chemical resistance. In general, working very closely with your safety supply vendors to ensure that you have the right shoe for the right job to help prevent or reduce the incidence of slip, trips, and falls. But now let's enter into the realm of cleaning, maintenance, and housekeeping. And as Russ had pointed out earlier, mats and matting are critical. As the ANSI standard and Russ had pointed out, it is critical that these mats and mattings be used to keep the bad stuff out, to keep the contaminants, the water, the snow, the ice, the salt that may create hazards on the walking surfaces by literally stopping them at the door. It is important, as Russ had pointed out, to inspect and maintain these on a regular basis to ensure that they, in and of themselves, do not become a slip, trip, and fall hazard. Now let's talk a little bit about our housekeeping, cleaning procedures. The ANSI standard requires that facilities establish written procedures to ensure consistency so that employees from shift to shift, from day to day, week to week, are implementing the appropriate cleaning and maintenance procedures to ensure a safe walkway surface. Now, these written procedures should be comprehensive in nature and address not only the where, when, and how, but also the type of cleaning products, materials, the equipment, the frequencies by which we will be cleaning and maintaining those floors. Not only covering the routine cleaning and maintenance operations, but those procedures we need to have in place should we encounter a slip, trip, and fall hazard, such as a significant spill of liquid that needs to be removed in order to present a safe walking surface. Routine cleaning and maintenance is critical, and we cannot stress enough the need to establish the appropriate cleaning frequencies to maintain a good traction surface on those walkway surfaces. And in so deciding as to how frequent you need to clean, maintain those surfaces, you need to take into consideration the use of the facility, the extent of foot traffic, the type of foot traffic, type of flooring, a holistic approach to help you all better determine the best way and best frequencies to treat those floors. Likewise, you need to give careful consideration as to the type of cleaning and maintenance products that you'll be using on those surfaces, using products that are appropriate for the surface so that they, in and of themselves, do not create a hazard. And better than that, that they actually create a safer walking surface by enhancing the traction of those surfaces. The simple things are sometimes the most important, and that's true in this case. Please be sure to follow those directions for use. These products are chemically and scientifically formulated, and if not used according to their directions, can in fact create a hazard, can create a floor that's slippery and conducive to slips and falls. Follow the appropriate dilution ratio, mixing the right amount of product as called for on the label again to avoid creating an unintentional slipping hazard. The product label calls for rinsing. Please follow that as well for the very same reason as I've suggested. We're going to see this in the OSHA regulation, but it's already there in the ANSI standard, and that is the important obligation of on a periodic basis inspecting and monitoring your floor and walking surfaces, not only in workplaces, but especially in places that invite the public in, for example, in retail stores, airports, other public facilities where the public's attention is going to be not necessarily on the walking surface. So as facility managers and those who otherwise maintain those floor surfaces, please realize that inspection and monitoring those surfaces is all part of the equation of preventing and reducing slips, trips, and falls, looking for those hazards, whether it be water, liquid, oil, other foreign objects, and to properly cordon off that area and notify people responsible for cleanup as soon as possible. Now, warnings and barricades play a critical role, and that's recognized again in the ANSI standard that I referenced earlier. And specifically when a slip, trip, and fall hazard such as a spill is found on the floors, you want to put out those warning signs as quick as possible and put it in the areas on all approachways to that particular hazard so that people clearly can identify the hazard and walk around. Now, you want to maintain those barriers until that cleanup is complete. Cannot stress enough the importance of maintaining records, of identifying the nature of the hazard that was observed, whether signage or barricades were used, and in fact when cleanup was recorded. This is all part of your safety plan, all part of your program to make sure that you're working towards reducing or possibly eliminating those slips, trips, and falls. Employee training is absolutely critical, and in this context I'm specifically referring to housekeeping staff. You can set up procedures, processes, buy the best products, but if you don't train your workers on how to properly use those products and products that you're bringing into the workplace to maintain the flooring, then all could be for naught. So you want to especially cover the safe use of those products, the proper use of those products, as well as safe handling and precautions to ensure that workers themselves are not presented with any undue hazards as a result of working with those chemical products. Moving on, the ANSI standard does recognize that preventing slips, trips, and falls, an important part of that is that there are certain workplaces where they just simply are inherently slippery environments. Now, this might include things like a food processing plant, a slaughterhouse, chemical processing, work areas where there is liquid present and prevalent on the flooring surfaces. And in these cases, the ANSI standard recommends that you install some type of controlled access, whether they be barricades, spill containment, signage, to ensure that employees or others avoid those dangerous areas. Largely in workplaces and other areas where the facility manager, for example, has the option of selecting or treating the particular flooring, you want to give some careful consideration because the actual flooring surface itself, the type of surface that's used and or how you treat it will have an impact on slips, trips, and falls and the incidents thereof. So if there is problematic walking surfaces, for example, grocery stores in or around the produce areas, it's typically a problem area because of dropped produce. So you may want to give some consideration to how the floors are treated there, again, for the purpose of enhancing traction and, again, reducing the incidence of slips, trips, and falls. Snow and ice removal, important for a couple of reasons. First and foremost, we want to maintain in a safe condition those walkway surfaces in or around the approachways to the entrances to our buildings. And just as importantly, you want to remove that snow and ice as soon as possible so that you don't have pedestrians tracking that material into the building and therefore introducing a slip, trip, and fall hazard. The ANSI standard, as alluded to by Russ or discussed by Russ, does also call for periodic testing of walking surfaces, and they provide a suggested coefficient of friction, static coefficient of friction of the 0.5. Now, excuse me, despite our best precautions, sometimes slips and falls do occur. And in the hopes and desires and goals of reducing or eliminating those slips, trips, and falls, it's very important that we investigate the root cause of that slip, trip, and fall that does unfortunately occur from time to time to ensure that we act in a manner going forward that eliminates those hazardous conditions that led to that slip and fall. So we want to capture as much relevant information as possible, such as the type of fall, where it occurred, type of flooring, the physical condition of the person walking on the floor prior to the fall. Did they have any physical handicaps, etc.? So we want to capture as much information as possible so we, in going forward, can eliminate any hazards and further reduce or eliminate slips, trips, and falls. That, ladies and gentlemen, is my prepared comments. For further information freely available to those all on the line today is our Safety and Health Portal, which can be found at issa.com/SHP. There you'll find a wealth of information that you can use to help prevent slips, trips, and falls, but on a whole host of other occupational safety and health topics that are relevant for you all in maintaining a safe workplace for your workers. That said, I'm going to invite Dr. Casey Choicewood to rejoin us with his segment on today's program. Casey?
Great. Thanks, Bill. Really fascinating information from both you and Russ. I'm going to take the next 10 minutes or so just to talk a little bit about some of the fall challenges that people face both on and off the job, because I think there is a connection between that, and sort of put slips, trips, and falls in the context of total worker health. Unfortunately, this is not an uncommon sight at work or at home. Ladders are one of the most common tools, one of the most common pieces of equipment that's used on the job and away from the job. And even a fall from a height as short as 6 to 8 feet, even less in some prone or in some injury prone folks, can result in a significant loss, either a loss of life or significant disability. So unfortunately, falls on a level surface or falls from short heights can be deadly, certainly can be incapacitating. And this is increasingly an issue as we get older. You know, today about 1 in 5 workers that are active on the job are greater than age 65. And it's not uncommon for organizations to have workers who are in their 60s, 70s, 80s, even into the 9th or 10th decades of life. It's very common to have people who still come to work. The estimate is by 2020, 1 in 4 workers will be over the age of 55. So the interplay between our personal health issues and our and the risk for falls and other workplace challenges are real. But I don't want to take the focus over what really are the major reasons of falls, the Big 10, if you will. And if you'll look at this list of the Big 10, aging is not on this list. Personal medical condition is not on this list. An underlying substance use issue is not on this list. These are all things that we can do something about. You may not be able to change the fact that your worker or a guest in your location has diabetes and therefore has numbness in their toes and feet and don't really know where their feet are in space. But you can control the nature and the condition of that space where they're in. So while it's important that oftentimes personal health conditions are a cofactor in falls, the actionable information is that this list are the things that we can change. We can improve lighting. We can improve the conditions of our floor, how well surfaces are maintained and drained. We can get rid of tripping hazards. These are the controllable risk factors. With that said, as individuals, as you as an individual listener to today's program, it would be helpful for you to know some of the other challenges that are at play when it comes to your risk for slips, trips, and falls. Our body mechanics, how often we walk and move in space, will predict whether or not we're likely to fall. If we're sedentary the vast majority of the time, our risk for falls goes up. If we're moving more of the time, and that's the nature of our body and the way we use our bodies and explore our surroundings, we're less likely to fall over time. There's conditioning that occurs that strengthens our core, that keeps us reacting to different surface changes. So all those things add to our safety as we move. We certainly know that certain medications increase our risk for paying attention to our surroundings. They may cause dizziness. It's not uncommon for high blood pressure medications, certainly narcotics. Those can certainly impact our likelihood for falls. Underlying chronic conditions as well. Poor sleep, we know, is a contributor to a number of health challenges. If we're drowsy, we're not as aware of our surroundings. Joint pain almost sort of makes natural movement more difficult. So if we have any type of arthritis, especially in the weight-bearing joints of the hips or knees, we're less likely to respond to different changes in the environment, the surfaces of floors. It can have an impact on our risk for falls. Obesity, especially if it's significant, changes our center of gravity and makes us less likely to be able to recover when a slip is underway so that we can avoid a fall itself. Our mental health condition, our level of anxiety or depression, is also a potential risk factor because it can be distracting. It can involve the use of certain sedating medications that can decrease our sensory awareness of those risks around us. And oftentimes we try to do more than one thing at once. You might have been texting while walking or talking on the telephone while walking. Those can add additional challenges as well. Certainly slip, trips, and falls can occur anywhere regardless of where we are, especially if we're doing multiple things at one time, like carrying packages or groceries or boxes, because it is these things that oftentimes take away visual cues that let us know that a hazard is in front of us. Age does affect balance, we know that, and the risk of same-level falls does increase with age. We have good NIOSH science to show that. We also know that some jobs are fatiguing, and that may contribute to the risk of slips and trips. Some people may be more likely to fall when they're tired. They'd be able to recover if they were not as fatigued. Eyesight issues certainly correspond closely to the issue of adequate lighting. And when we're designing workspaces for older workers, adequate lighting, non-glare surfaces is very, very important for a number of reasons, not of which fall prevention is at the very top. And then, of course, the importance of footwear. Shoes that are too large oftentimes become a trip hazard, and employers have the ability to provide good-fitting shoes, to have workers fitted with the right kind of shoes. We think that's a valuable investment. When it comes to distraction, it sort of begs the question, do you need your own seeing eye person these days so that you can text or look at your smartphone and walk safely at the same time? This really reminds us that distractions are a significant personal risk factor when it comes to falls. When NIOSH looks at the issue of slips, trips, and falls in the workplace, here are some of the main challenges that we're facing. And it's important that we study it because slips, trips, and falls represents the third most common cause of workday-related injury and illness. And you can see that it's a significant portion of the challenges that workplaces face when it comes to keeping workers safe. As Bill mentioned, it is important to look at past incidents and learn from them. Make sure we're doing frequent on-site hazard assessments, walkthroughs, and checklists. Employers who provide slip-resistant shoes for their workers are making a good investment. Obviously, hygiene issues that we've talked about, clearing clutter, making sure ice and snow is removed. This is a good reminder from the things that we've been hearing earlier today. I especially like this slide because it talks about design, another built-in way for us to decrease the risk of falls. And lighting is perhaps one of the best ways to do that, replacing burnout bulbs promptly, making sure electrical outlets are placed so that cords don't have to run through the commonly traversed areas of our workplace. We call this prevention through design, so using the actual built environment to avoid likely injury and illness. It's sort of a built-in solution, if you will, and we think that that's money well spent, especially when you're trying to avoid injuries and illnesses related to slips, trips, and falls. Keeping floor surfaces clean and dry, extremely important. And this is something that may take more effort than the designed-in solutions that we talked about before. So these are going to be things that have to be on a checklist, have to be done on a regular basis, especially if weather conditions or conditions of the environment warrant. One of the built-in reminders we have in one of our entrances at NIOSH in our mountainous location in Morgantown, West Virginia, is signage that automatically turns color when the temperature falls below freezing or near freezing to warn people that icing of surfaces is starting to occur or could possibly occur. This built-in warning is really valuable to the people entering and leaving that facility. Indoor walking spaces, this is true both at home and at work, but if you have someone at home who you're concerned about having a high risk of falls, get down on the floor surface and look for those challenges. Are there loose or buckled carpet or other flooring materials that are not well maintained? Looking at trip hazards over a 1/4 inch high, specifically looking at where those gaps are and taking steps to prevent them. Putting alerts or visual cues around those common spaces where people are likely to fall or have fallen before is a very important intervention. NIOSH has also developed a smart phone application for ladder safety, and I would encourage you, if you haven't seen this, to take a look at it. It's available for free from the App Store. They're both Android and iPhone versions of the ladder safety app. And it basically is not only a handheld version with lots of information about how to use a step ladder or an extension ladder safely, but it also has a built-in ladder angle tool to make you sure that your ladder is angled properly so it's less likely to fall. It's a really great application that's available free of charge. I also like to concentrate a little bit on slips, trips, and falls from a home or away from work perspective because as we mentioned, we don't always keep our work challenges at work and we don't always keep our home challenges at home. So these are some additional reminders for us to take a look at in our own homes, or especially if we're caring for older adults in the home setting. Making sure that we're using high traction adhesive strips on stairs, high traction mats or appliques in those wet, slippery areas. Grab bars can play an important role, especially for people with underlying health conditions that might predispose them to fall or to increase injury or illness should they fall. Lighting, we can't say enough, both for day and nighttime use. And for older adults, making sure that oftentimes or often used items that they need to access that might be just slightly out of reach can be moved so that they're not tempted to use a stepladder or a kitchen chair to get up and try to retrieve an item. And certainly, if necessary, those additional walking devices such as canes or walkers will aid in stability for those individuals who need them. As we wrap up, I will just invite folks to take a look at NIOSH.com. It's a free website with tons of information about injury and illness prevention in the workplace of all types, much of which can be used to decrease your risk of injury or illness at home. And if you are interested in the concept of total worker health, how we take a holistic approach to preventing injury, illness, both at work and at home, I'd invite you to Google Total Worker Health. We have tons of information for employers and individuals on optimizing your health, safety, and well-being. And with that, I will turn it back over to Bill to see if there are any questions and answers and wrap us up for the day. Bill?
Thank you so much, Casey, for tackling a really challenging subject with some very, very good pragmatic information. Ladies and gentlemen, we do have some time for questions and answers, and we have quite a few that have come through the system already. But before I go to our first question, I want to remind everybody that today's slides, the PowerPoint presentation, will be made available to you via email, sent to you shortly after today's session, with directions on how you can access the PowerPoints that were used in today's session. We've got a number of questions here, and Russ, I think let's start with you. You had shared with us some really good information on the major causes of slip, trips, and falls. And question number one asks, what are the basis for the statistics that you had quoted, major causes of slips, trips, and falls?
Yeah, thanks, Bill. That's actually a very good question, and one that we're asked quite a bit. Information is pretty hard to come by, data as it relates to fall statistics. The Bureau of Labor Statistics produces some data, Centers for Disease Control, National Safety Council. There's a series of organizations that collect data. We utilize all of those, but we also go one step further. We collect private data from independent insurance companies, those who are self-insured, and they're insurance companies that oftentimes work with them on the claim side. And so our snapshot, if you will, is a little bit broader because it incorporates a lot of data from other sources plus private information. Again, this is not an exact science. How and why people slip and fall tends to be somewhat more complex. But our data, as we produced in our pie chart, comes from a very, very broad range of industries and a real broad range of sources. And again, just represents a snapshot of causation. As Casey mentioned, there's a wide range of contributing factors, age, medication, preoccupation, that we don't measure, that I'm not certain can even be measured, but play an important role in how and why people slip and fall, and frankly, how many people can prevent being the victim of a slip and fall.
Thank you, Russ. Casey, we've got a question for you. How can workplaces support those workers who might be at greater risk for whatever reason for slips, trips, or falls while on the job?
Yeah, that's a great question, Bill. And there are steps that workplaces can take to first of all, to alert workers to the fact that, hey, we care about your personal health conditions, and we're going to do what we can to help optimize your chances of making it through the day safely, of giving you the tools and supports you need. So I would say it's important to offer that service in a confidential, private way where you safeguard someone's own personal medical information, have a robust, reasonable accommodations program for those people who do need extra protections based on a personal health condition. And also, we need to do a better job of training our frontline supervisors on recognizing those workers who may have a challenge, who may be struggling with some sort of physical or work demand that they're not able to meet carefully and safely. I also think it's important for us to just talk about these, educate our workers that these are real issues, and we know as folks get older that these are going to be an increasing challenge for all of us. When you talk about things, people are aware of them, they start thinking about it, and they're more likely to come forward if they believe there are supports and private confidential help should they need it. So creating that culture, that environment where employers care about the well-being of employees, opening the door, saying we can help you if you have personal concerns, inviting people in to request accommodation if necessary. And here's the other thing. A lot of these interventions are good for people whether or not they have an underlying medical condition or not. A lot of these interventions are good for young people, middle-aged people, and old people. So a lot of these things are good regardless of underlying health condition.
Great. Thanks so much, Casey. Russ, you spoke to a number of the relevant ANSI standards. And we've got a question that came across about the relationship between NFSI, the National Floor Safety Institute, and ANSI. Can you explain what that relationship is?
Yes. In fact, prior to 2006, when the National Floor Safety Institute was named the Secretariat of the ANSI B101 Committee on Slip, Trip, and Fall Prevention, there really wasn't any specific ANSI committee or specific ANSI standards that outlined in great detail methods of evaluating or testing floors. The only real standard that existed was the ANSI 81264.2 standard, Bill, that you spoke to, which was more or less a general guideline and really only applies to workers in the workplace. Doesn't apply to folks at home or folks that are not working. And so the relationship between NFSI and ANSI was established by way of ANSI. They were had awarded the NFSI the distinction of being the standards developer for this area, as I mentioned, in 2006. And just last year, ANSI awarded us the distinction of being the exclusive training organization in North America on the subject of slip, trip, and fall prevention, to which if any of the members online would like more information, they can do so by going on our website, nfsi.org. But the ANSI designation is now called WACH, W-A-C-H, and if you pass the WACH project, the program, it's a training class and examination, both written and a field test, you become a walkway auditor, certificate holder, or again a WACH, and that certificate is issued through the NFSI, but is an ANSI accreditation, and so we pretty much have, I guess you can say, cornered the market on standards development and training in this very, very important issue, and did so because of the vacuum. There just really wasn't anybody out there doing it or willing to do it, and so we're very proud to be the industry leader in this area.
Well, Russ, we thank you for all the great work that your organization's done in that regard. But a quick follow-up related to the ANSI standards that you're working on and that you'll continue working forward on. Can you share with us how the people on the line can get more actively involved?
Certainly. The ANSI B101 committee is open to anyone to join. If you, again, go back to our website at nfsi.org, you'll see a link that says it has the ANSI logo. You can click on that, and it'll guide you through a link for applying to be a member of the committee. The committee is well balanced. There's a maximum number of 30 members that serve on the committee, and right now there's a bit of a waiting list. The committee is structured with 3 groups: general interest, meaning just folks that have an interest in the subject. There's producers or manufacturers. They serve also as 1/3 of the body. And then users, the folks that are impacted by these standards, also have representation on the committee. So for those that have an interest in learning more, visit our website. If you would like to attend our annual meeting, which is held every April of every year, it's free. Anybody can come in, participate, sit in the meeting. And if you have an interest in joining the committee, you can do so by completing an application via our website.
Great. Thanks, Russ. Very helpful. Folks, we emphasized the importance of safety shoes during today's presentation, and we've had a few questions along the following lines come across. We have employees working in a chemical and food processing environment that's inherently dangerous, a lot of liquids on the floors. What kind of safety shoes work well in this scenario?
Is that directed to me, Bill?
Oh, either or. I'm sorry. Yes, Russ, why don't you take a step and then we'll go to Casey.
I'll take it first, and maybe Casey can complement areas that I may be missing. There's 2 terms that oftentimes get misused in terms of protective footwear. There's safety shoes, and then there's work shoes. A safety shoe oftentimes is one that's required and paid for by an employer, and it provides some level of safety to protect the foot, where a work shoe is one that generally is polishable, has some type of ankle support, and has a slip-resistant sole, and is designed to protect the entire person, not just a person's feet or foot. And so understanding the terminology really goes a long way. Again, as I mentioned earlier, there are sadly no nationally recognized standards that quantifies any degree of slip resistance when measuring slip-resistant shoes. And so it's up to the buyer to beware as to whether or not the product that they're purchasing is in fact slip-resistant for their particular task. Another area to consider is what constitutes a slip-resistant sole for a restaurant kitchen doesn't necessarily mean that that particular shoe is slip-resistant on a job site, a construction site, which requires a very different tread pattern. So the key is to really match up the appropriate type of outsole and shoe construction itself to the task, to the job. Sadly, that's not always the case. And lastly, oil-resistant, printed on shoes, does not mean slip-resistant. It simply means that the shoe will not degrade, the sole of the shoe will not degrade when exposed to oils, whether they be natural or petroleum-based. Soles that are not oil-resistant tend to dissolve or break down when exposed to oil. So the key is to do your homework and, I guess, frankly, support the move to develop better standards that quantify performance of shoes in a wide range of applications, both in the home and in the workplace.
Great, Russ. Thank you. Casey, anything you might be able to add to that?
Yeah, thanks, guys. I agree with all that was said by Russ. I would just add that I think it is important to match the set of hazards that workers will encounter with the right protective equipment in general. Certainly the right kind of protective footwear is personal protective equipment. And with all PPE, it's important to train folks on what it can do for you and what it's not likely to do for you. Training and provision of personal protective equipment, we believe, is largely an employer or an organizational responsibility, and we would encourage employers and organizations to take an active role in selecting and recommending the right kind of equipment for the nature of the job itself. And then lastly, I'll just put in a word on proper fit. People will only use equipment that's comfortable, that is well fitted, that doesn't produce a secondary risk of injury or hazard, or lead to a soft tissue or a breakdown of the foot tissue. So it's important that you have proper fit to any personal protective equipment as well.
Thank you very much, Casey. And we've got time for just one more question. And the question is as follows. Does marking or highlighting floor hazards that cannot be eliminated, things like raised edges in floor trackways, does marking or highlighting those type of hazards prove effective at reducing the incidence of trips related to such hazards? Casey, would you like to take a stab at that first?
Sure, happy to do so. And it is recommended by NIOSH to put in that visual alert if you do have differentials, kind of shifts in the terrain more than just a very slight amount, because it only takes a quarter inch or so for that to become a trip hazard. But clearly, just marking a hazard or alerting people to it is not nearly as effective as taking steps to get rid of it altogether. So that would be really where first dollar investment should be. So think of highlighting or pointing out a hazard as maybe a temporary fix before a much more useful permanent fix can be done.
Well, thank you, Casey. All good advice. And ladies and gentlemen, that brings us to the conclusion of today's program. We thank you all for joining us. We will, shortly after today's session, be sending out an email with a link to the PDF file for today's PowerPoints. And we'll also be sharing with you the link through which you or your peers, coworkers, friends, etc., can view and listen to the archived webinar. From ISSA, thank you, and look forward to sharing our next webinar with you. Have a good day, everyone.